Hi guys, I'm Rishi Tandalwadkar. I'm the founder of ALIV Regenerative Wellness, and this is a brief consultation video about our skin rejuvenation protocol. We have a lot of different types of people approaching us for the skin protocol. Some people want to go a shade lighter, some people want to remove pigmentation, some people want to reduce their tan. A lot of different applications for the skin protocol. But before we get into the details of how the drip works, let's understand glutathione. I'm sure if you've reached out to us for IV therapy, you've already heard about glutathione, or you know someone who has tried glutathione, or you've done some research about it, right? Glutathione is an antioxidant that is naturally made in our bodies, but it is not made enough to ever be in excess. When glutathione is present in excess, it has a positive side effect, which is it prevents the action of melanin. Melanin is the compound that causes our skin to get darker. So the skin rejuvenation protocol using IV therapy and glutathione actually relies on this side effect. If your existing skin tone is very far away from what your original was, then this is a recommended therapy for you. But if it's just slightly, maybe half a shade lighter and you want to go back, then I don't think we should look at skin brightening. Let's focus on skin rejuvenation. Skin rejuvenation is an absolutely brilliant application of glutathione, but along with this at ALIV, we add about 15-20 more elements into this. It's not just your vitamin C, glutathione and some other B12 or B complex which most people add. We have to add collagen, we have to have CoQ enzymes, we have to have some other trace elements, we have to have epidermal growth factors, right? So there are a lot of different things that go into the skin rejuvenation protocol at ALIV. If there are certain specific issues like dark circles, some different reasons why you're getting some spots, any form of acne, scarring, these are things that you need to visit a proper dermat for. IV therapy is not going to help you with this. It's not a one-directional approach. When you're doing something for your skin, you have to look at the whole circle. You have to look at one part, which is IV therapy. Then there's your water intake. Then there's your sugar intake. Then there's your mobility and lifestyle related aspects of things. Are you getting all the nutrition that you need from your food? Are you getting enough protein intake? All of these things matter. Along with this, then comes some topical things that you do for your skin, like a basic skin routine, which involves a toner, a serum, a moisturizer, and a sunscreen, and then IV therapy. For all of this to come together, you will see the best results of the therapy. So how does the drip work? When you take an IV drip, it's a 45-minute to 1 hour drip. We give you all these elements directly through into your bloodstream. These elements work at multiple levels. The star element is still glutathione. Glutathione naturally is used actually by the liver. It's one of the most powerful antioxidants in the body and it is used for organ health. At ALIV, we use a couple different types of glutathione. One which is focused on your organ health, one which is a little bit more focused on your skin. We have to ensure that your body's requirement of glutathione goes down, and then we are giving you a little bit of excess to get you those results. All in all, the skin rejuvenation protocol is great if you're looking for a support to your skin levels aging drastically. Glutathione and these nutritional elements can help you slow down the aging process, can retain a glow on your skin, and also help you a little bit with your pigmentation, skin tightening, your wrinkles, things like that. But there are other things that you need to do, as I mentioned earlier. Normally, we recommend at least 8 to 10 sessions of the skin rejuvenation protocol. The sessions happen once a week. So for 8 to 10 weeks, once a week, you will come in and you will take the IV drip. For the rest of the days, just make sure you use sunscreen, you're hydrated enough, and your protein intake is enough. Our skin rejuvenation and skin regeneration cycles in the body are 30 to 40 days. That means in 30 to 40 days, all your old cells die and they are recycled and new cells form. Because the skin rejuvenation protocol, the skin regeneration cycle in the body is so long, we need to supplement you for at least 2 cycles of that regeneration. So generally people don't see any major results in the first 3 to 4 sessions. By session 5, session 6, session 7, the results start setting in. By session 8, session 9, session 10, we accelerate and attenuate these results. So that's your peak result. But for some individuals, it could take few sessions more to achieve the same thing that another person achieves in a little bit lesser. Our bodies are different, our requirements are different, the dosages are different. So you have to be a bit patient when it comes to the skin. But if you're looking to go one shade lighter than what your natural levels are, our natural levels are the levels that are inside your underarm, which has never been exposed to the sun, or parts of your body which are the fairest parts. That's your natural skin tone. Your other skin areas will go towards that natural skin tone, but you will never go beyond what your natural skin tone is. So if that is something that you're looking for, this is not the right therapy for you. This therapy is ideal for overall aesthetic anti-aging. Few things to take care of when you're planning to do the drips with us. On the day of the therapy and for 2 days after, you cannot have alcohol. Also, you need to focus on your water intake, your sunscreen, as well as your diet. These things are essential to get the best results out of the drip. It doesn't mean that if you don't do these things, the results won't come. But in some cases, the results are delayed. Sunscreen, however, and alcohol intake is a non-negotiable, because the glutathione levels in your body drop down to 0 even after a couple of drinks. And if it's working on preventing the action of melanin and you don't use sunscreen, then the sun is working towards making that melanin work for you. So it's counterintuitive. Apart from this, there's nothing else that you need to focus on. The drip is great, the results are great, but it is never going to take you a couple of shades lighter than what your original skin tone is. The drip is indicated for people with dull skin, pigmentation, who want to delay the impacts of aging on their skin and have a better quality, better texture, and this glow on their skin. So if you have more questions, reach out to us and we'll help you get started.